This is a child 7 years in age. I'm showing you the patient's left side nasal cavity on the screen's right and the inferior aspect. You can see a tubular structure here. This is called as the inferior turbinate, and that is usually an erectile tissue. So when the patient is exposed to the allergies outside, this swells up and kind of blocks the nose almost completely. And as you keep going down, deep down inside, you can see that's the adenoid tissue. That's the area of the nasopharynx where the nose and the mouth connects together. This leads to additional blockage, and the patient lands with snoring and excessive mouth breathing. Now, the same thing I'm going to show you on the X-ray nasopharynx here. So that is the patient's lateral view, and that's the nose, and that's the nasal bone up there for your orientation. That's the entire nasal and the sinus area. That's the skull base, and that's the pituitary gland, and that's the brain above. So what you can see here on the screen is the adenoid tissue, the huge white shadow here. This patient has massive grade 3 adenoids. The air enters like this, inferior and posteriorly in the nasal cavity, and tries to go through the nasopharynx, down in the oropharynx, and down the windpipe. That's the windpipe, and that's the food pipe behind, and that's the spinal cord. So you can see the huge adenoids is kind of narrowed down the airway, and that's difficult for the kid to breathe freely, and that the kid lands up in the excessive nasal blockage, snoring, and mouth breathing. The usual treatment for this is reduction of the inferior turbinate and the adenoids.